I'm Professor Willem Kijken, and the project that we're working on together is the Mood Disorders Centre. Our goal really is to look at the problem of mood disorders as they're experienced in the National Health Service, to understand them better, to develop treatments for helping people with mood disorders, and then to make those treatments as accessible as possible. For me, the model that is really effective is a partnership between the university, the National Health Service, and people with a lived experience of depression as well.
My name is Laura Pragnall and I live in Exeter, and I've been involved in the Mood Disorder Centre for about 3 or 4 years. I first came to the Mood Disorder Centre because I saw a referral form at my GP surgery, and it was talking about and asking if you'd ever had recurrent depression, which I have suffered from. And the Mood Disorder Centre seemed to be offering a new perspective on treatment. They invited me to attend some mindfulness sessions which were run at the university. So I worked within a group of 8, and we were taught self-help techniques and strategies to help us deal with our depression more effectively.
My name is Dr. Paul Farrand, and I work within the Mood Disorder Centre, and I have a number of roles. I have both a research role and a teaching role and a clinical role as well. The benefits of locating research activity within the university and within the Mood Disorder Centre is that the Mood Disorder Centre has access to a range of resources. And what we should never forget is that research is a high-level activity that does require investment and does require an infrastructure and does require resources.
The grants that we hold within the Mood Disorders Centre are actually awarded by the National Institutes for Health Research, the Service Development and Organisation, and the Medical Research Council, and those grants are then awarded to the University of Exeter and delivered again in partnership with the NHS.
It's really empowering for service users to be involved, because universities can sometimes seem a bit remote, but I think with the university and the work I've been involved with, I felt really valued by the university in terms of being a member of the community, but also being valued as a member who's had these life experiences, but they can be used to good effect to help others.
What we're trying to do is the very best research that we can possibly do, which has the highest impact out there in terms of journal articles, but also in terms of impact in terms of service design and delivery.
And there's talk about, is what we're doing here in the Southwest a model of service delivery, of service organisation that can actually be rolled out nationally? And what I would hope is that people who suffer from recurrent depression, who would like an alternative to maintenance antidepressants or a way of learning life skills that will keep them well in the long term, that the work we've done here will roll out to actually influence people around the country.